Hey gang, well this is the video I said I'd make to go into Katie's injury and subsequent medical care and maybe talk a little bit about healthcare in general overseas and what the expectations are versus reality. Anyway, see you at the video. All right, well, welcome to the video. I watched my first couple takes on this one a couple times and I was bored, so I thought I'd come up to the rooftop garden here in Chiang Mai because it's a nicer place to be, and try to boil the basic pieces of the video down into really just single points. So Katie injured herself right before we left for the trip, literally the day before, and we spent the first couple weeks of the trip dealing with the fact that she was largely immobile. She hurt her back, and even though that's something we've dealt with before and it's an existing condition, it was very much a different injury and pretty acute this time. So we could tell fairly quickly that it wasn't going to be something that a couple days rest would take care of. So real quickly, looking at this photo, this is the one photo I have of Katie where it kind of shows how she was walking for the 2 weeks of the trip, really for 3 full weeks. You can see how crooked she is here. She was bent over and could not, trying to relieve the pressure on her nerve down in the lumbar region, so she walked with this really bad tilt. So that was what we were dealing with, and we knew this wasn't good. When we got into Thailand, we had things worked out with Bumrungrad. The one thing that we had to deal with was getting her previous MRI that she had taken back in September, getting that to the doctors in Thailand, and thanks to John Hunter, we managed to do that even though we had failed to take care of that prior to leaving on the trip. So this is Bumrungrad. I'm going to show images over my video here, but this is Bumrungrad, which is a hospital, a private hospital in Thailand that specializes in medical care for folks from overseas. It also treats plenty of people from Thailand, but a lot of the folks we encountered here were from various Middle Eastern countries and other parts of Asia. So when we met with the doctor, he had reviewed her previous MRI and he had already set up a subsequent test we were scheduled to do after we saw him. But it was obvious from the review of the existing damage that, you know, he was going to need to do another MRI. For us to be able to determine what to do, so he could see the change between the previous one and this one. So we ended up, you know, here's one of the crazy things about the medical care here. Since the doctors are all associated with hospitals, all their clinics and everything they need are in the hospital. So basically, to get different things done in the hospital, you jump from floor to floor. Like, we basically had to go a couple floors down to get the MRI done. We had to go a couple floors up to get an X-ray done. We had, on that same floor, we were dealing with blood work and getting lab work done. All of it's self-contained, and all of it can be scheduled to be done almost the same day or the very next day. So we quickly went from a consultation with the doctor and a follow-up test to the following day we were doing an MRI. And then the day after that, we were back in to consult with the doctor again about what to do. At that point, we chose surgery. It was obvious that it was a physical impingement on her nerve, and it wasn't just going to go away. And so we knew we had to get rid of that bone that was pressing on the nerve. That the only way to really get rid of her pain was to take care of that. So we knew it meant surgery. The surgery was going to be performed by that very same doctor, and he's considered to be an expert in that type of endoscopic surgery, so we felt comfortable with him. He spent a ton of time with us to answer all of Katie's questions and my concerns about both the procedure and what other potential options were, which there really weren't many that were realistic. So we quickly did decide to do surgery. This also meant that we were going to be spending at least one night in the hospital, or Katie was. So we had to go down and take care of that. And I can show you some imagery of the room, but it was spectacular. I mean, I've been in a lot of hospitals in the U.S. and I've never seen a room this nice, this much room. You had a microwave, a refrigerator. It was comfortable for other people to stay in. That's kind of the type of service you get when you come to one of these kind of hospitals. So that was what we were experiencing while we were doing this, and the whole thing made us feel very comfortable. Now, I'm not going to say it was cheap, but we got good value for our money. Everything that we got, the surgical team, the surgical facilities, the hospital care, the number of attendees taking care of Katie, the fact that everybody spoke good English, and we were able to speak with them. It was all worth it. The amount of money we spent was still not even close to what we would have spent just having medical insurance coverage back in the U.S. for the year. So I still consider it a deal. Now, it was roughly $10,000 for us to get this done. So I know that seems like a lot, but that's still, in retirement, working under fixed income, working under an annualized budget, it's still something that I can prepare for and that I was okay with spending out of pocket. And one of the things I wanted to mention during this video is, over the course of the couple days there and dealing with this kind of a system, I realized, the world back home in the U.S. is really, the doctors have to cater to the insurance companies. All of their thought process is about, how am I going to convince the insurance companies to do this? How do I collect for this procedure? So their infrastructure is all around collection and convincing the insurance company things, rather than really taking good care of you, spending time with you, meeting and discussing the procedure with you. That it felt very different, and I'll say it in terms that consulting people will understand. The client back home is really the insurance company, if you think about how we're structured. And because I was paying out of pocket, I was the client at Bumrungrad, and therefore their job was to make me happy, and they really did a good job of that, and we got excellent medical care for our money. So even though it was expensive by Southeast Asia standards, it was every penny worth it, because I now have, that's the punchline here, is I now have a Katie that feels better than she's felt in years, had a procedure and wasn't scared going into it, and she's doing really well, and she got good physical therapy afterwards, and she's following up on that and continuing to do her exercises. So I went from having a Katie that had to walk around crooked to having a Katie that can now go places with me and see the things we want to see. So I think it was totally worth it. Just real quick, to give a precursor to some of the future videos, I'm going to take this and share where I am. This is the rooftop at Chiang Mai, where we look out. This is our view, and we look out around this area. So this is some of what you'll see when we look, when I do the video that I will probably do on Chiang Mai City. So yeah, this is a pretty cool little area. You got lots of local wildlife in the form of pigeons. Also, myna birds are real common here. The common myna is a big bird. And just real quickly, I'll go over and show you the rooftop pool that I can hang out in if I so desire. So here's a good view of that facility. I'll give you some other photos from that later. I don't think I'm really going to do this kind of thing very often, but walking around and talking into a camera isn't my thing. But yeah, so that's basically how I felt about the care that Katie got and what our experience was, as well as just kind of thoughts on healthcare. And I think the bottom line is, anybody that's thinking about doing a similar thing, is the healthcare overseas can be really good, and and you can get top quality care overseas. I think in the U.S. we think everywhere else is not as good. We tend to think that way, but we found the care we got here to be quite a bit better than most care we've gotten back home. So, all right, thanks.